I'm Susan Sloan, an agent with Real Health Quotes. Has this ever happened to you? You're turning 65, or you're finally ready to leave your job. You're losing your group coverage. You may be giving up individual or family coverage, but you know you want to go on to Medicare. There are so many different choices out there for you. There's Medicare supplement plans, Medicare Advantage plans, or original Medicare. And depending on which friend you ask, they'll tell you, you need one, or you need another. And then you get stacks and stacks of mail from all the insurance companies, and you just look at it and want to throw it all away because it's way too much, and you don't understand your choices. This is a basic primer today, the differences between a Medicare supplement plan and a Medicare Advantage plan. We'll go into more depth in other videos about the different types of plans, but in this one we're just going to go with the differences. Medicare supplement plans supplement original Medicare. Original Medicare has gaps in it. And sometimes a Medicare supplement or Medigap plan fills in those gaps. When you are looking at a Medicare supplement or a Medicare or a Medigap plan, be aware it doesn't contain prescription drug coverage. There are a number of different plans to choose from, plans A through Plan N. You must have both Medicare Parts A and B in order to obtain this coverage. When you go to a provider, if you have a Medicare supplement or Medigap plan and you go to a provider for medical services, you're going to hand up both your Medicare supplement card as well as your Medicare card. The provider is going to bill Medicare first. Medicare will pay according to Parts A and B, and then they will send it back to the provider. The provider will then bill your secondary insurer, which may be a life insurance company or it could be a health insurance company. They'll pay according to your benefits in the plan that you selected, A through N. And then if there's any balance left over, any cost sharing, you'll be billed separately. Again, with a supplement plan, you need to pick up a Medicare prescription drug plan separately. They're not included with these plans. There's no difference between one insurer's A plan or one insurer's F plan or N plan than another insurer's. Those benefits are standardized. You're looking at price, you're looking at strength of the company, but there's no difference between one insurer and the next. Medicare is the only network you have to worry about. You have to make sure the provider accepts Medicare. If you go to a Medicare Advantage plan, a Medicare Advantage plan is done through a private health insurance company. You not only have to make sure that the provider participates with Medicare, but you also need to make sure that they participate with your health insurance company. You are looking at networks in most cases. Some private fee-for-service and medical savings accounts don't have networks, but most do. They can be PPOs, they can be HMOs, they can be point of service, which is a hybrid between an HMO and a PPO. They can be medical savings account plans, they can be private fee-for-service plans, they can be cost plans, or special needs plans, which are for Medicare, Medicaid, dual eligible people, as well as for some people with certain chronic illnesses. Medicare Advantage plans can only be applied for initially when you're in your initial enrollment period, and then every year between October 15th and December 7th. When you go to a provider, you do not hand up your Medicare card because you don't want them to bill Medicare. Medicare will deny the claim because the private insurer is your primary insurer. You only hand up your Medicare Advantage card. They will bill your insurance company. After that insurance company has adjudicated the claim, they will then send it back to the provider, who will bill you for any cost sharing that you have. In some cases, you have already paid some co-pays. Medicare Advantage plans may have prescription built in, and in most cases they do. There are certain plans that don't include prescription drug coverage, and that would be a medical medical savings account plan, and certain private fee-for-service plans. You can also pick up an HMO or PPO Medicare Advantage plan without prescription drug coverage, but those plans are only available to people who have prescription drug coverage either through the VA, through TRICARE, through an employee retirement plan, or some other plan. You cannot pick up a Medicare Advantage plan and a standalone Medicare prescription drug plan. They'll cancel each other out. Most people will take a Medicare Advantage plan that has prescription drug coverage built right into the plan, and you cannot change that coverage. It is what it is, and generally they're very liberal prescription drug plans that are built in. If you have any questions regarding Medicare coverage or regarding any health insurance coverage, feel free to call me, Susan Sloan, at Real Health Quotes, 1-888-838-7281. Or you can email me. You can go onto the Real Health Quotes website, which is www.realhealthquotes.com, and you can also take advantage of our chat feature. I'd be glad to be of service to you. Thank you very much for your time.